Hello everyone, welcome to my YouTube channel Lighting the Knowledge Candle. Today we will be discussing about the quantifying risk, definition and formulas based on the classic contingency table or 2 into 2 table. Just remember, the classic contingency table will be looking like on a horizontal A, B, C, D. On a horizontal series we have discuss or outcome. On a vertical series we have exposure, that is our risk factor, yes above and no below. That is the presence of risk factor above and the no risk factor below. This is how the contingency table looks like. A is for in order to designate these. A is for if risk factor and disease both are present, A. If risk factor is present but disease is absent, B. If risk factor is absent but disease is present, C. If risk factor and disease both are absent, then it is D. This is how the contingency table should be drawn. Now, based upon this A, B, C, D, we will be deriving the formulas in order to calculate the particular risks and ratios. And odds ratio. The first term we will be discussing here is odds ratio. As we have studied, we have discussed about the odds ratio in case control study. Odds ratio represents the odds of exposure among cases versus odds of exposure among controls. If odds ratio is equal to 1, then odds of exposure are equal among cases and controls. If it is less than 1, odds of exposure are more in cases. If it is more than 1, if it is more than 1, odds of exposure is more in cases. Less than 1, odds of exposure is more in controls. If in a case control study, let's consider, for example, 20 patients has the disease and risk factor both, whereas 30 patients out of 30 patients, whereas 5 patients would be having risk factor but no disease out of 30 patients. According to the contingency table, odds ratio would be calculated by using the formula AD by BC. This is all about odds ratio. Relative risk, typically used in cohort studies. Risk of developing disease in the exposed group divided by risk of developing disease in the unexposed group. That is, incidence among exposed divided by incidence among non-exposed gives the value of relative risk, or we can also it called as risk ratio. We can also call it as risk ratio. Risk ratio is equal to 1, implies no association between the exposure and the disease. Less than 1 implies no less than 1 implies exposure, that risk factor is a protective factor instead of a risk factor. The factor that we had considered is in fact a protective factor but not the risk factor. If risk ratio greater than 1, exposure associated with increased incidence of disease. Risk ratio can be calculated by using the formula A by A plus B divided by C by C plus D. Or in easy forms, we can say incidence among exposed minus incidence among non-exposed. Relative risk reduction. Relative risk reduction simple formula is 1 minus risk ratio. Attributable risk. The difference in risk between exposed and non-exposed groups is known as attributable risk. That is, incidence among exposed minus incidence among non-exposed gives us attributable risk. In proportion, we would be calculating it using the formula incidence among exposed minus incidence among non-exposed divided by incidence among exposed into 100. Another formula for risk ratio that is to be remembered is attributable risk, that is to be remembered is percentage of attributable risk can be calculated using the formula risk ratio minus 1 by risk ratio into 100. Absolute risk reduction. The difference in risk attributable to the intervention as compared to a control. If 8% of the people who receive a placebo vaccine develop flu versus 2% of the people who receive a flu vaccine, then absolute risk reduction is equal to 8 minus 2, that is equal to 6%. In numericals, 0.06. Absolute risk ratio formula from the contingency table is C by C plus D minus A by A plus B, which has to be remembered. Number needed to treat. Number of patients who need to be treated for one patient to benefit is known as number needed to treat. Lower the number needed to treat, better the treatment. Number needed to treat formula is equal to 1 by absolute risk reduction. We have to remember the absolute risk reduction formula in order to calculate the number needed to treat. The formula for absolute risk reduction is C by C plus D minus A by A plus B according to the contingency formula. Next, case fatality rate. Percentage of deaths occurring among those with the disease is known as case fatality rate. If 4 patients die among 10 cases of meningitis, case fatality rate is 4 by 10 into 100, that is 40%. So the formula is deaths by cases into 100. Next, we will be discussing about the mortality rate. Number of deaths within a population over a defined period is known as mortality rate. If 80 people in a town of 10,000 die over 2 years, mortality rate is 4 per 1000 per year. Calculated by using the formula deaths by 1000 people per year. Attack rate, proportion of exposed people who become ill. If 80 people in a town are exposed and 60 people become ill, attack rate is 75%. Population who become ill by total people exposed, that is 60 divided by 80 into 100, which will be 75%. Attack rate, population who become ill divided by total population exposed, is the formula for attack rate. This is all about the formulas and definitions we are supposed to remember.